Hi, let's see an NCLEX RN video based on care of intraoperative patient. Which of the following is the identified leader of the surgical team? The circulating registered nurse, the anesthesia provider, the scrub nurse, the surgeon. So the surgeon is the identified leader of the surgical team. The surgeon has the ultimate responsibility for performing the surgery in an effective and safe manner. All others are essential members of the team. The operating room nurse is completing a peri-operative assessment for a patient who is scheduled for exploratory surgery. Which of the following interventions must be completed prior to this patient going into the operating room? Select all that apply. Verify operative consent has been signed. Assure allergy and ID bans are in place. Removal of patient's personal clothing. Determine evidence of advance directive. Validate completed patient history and physical examination. Determine NPO status. So in the peri-operative assessment, of course, you need to check for the signed consent, check for any allergies and ID bans, removal of patient's personal clothing, determine the evidence of advanced directive. You know that advanced directive, it is something like patient's wishes. That is when the patient is incompetent to express his or her wishes in a medical emergency. Usually it is done if the patient becomes incapable after the surgery, or it allows the patient to express desires related to organ donation and end of life issues. So we can have any evidence of advance directive, or is there present or not, you can have a check. Then validate completed patient history and physical examination, and we need to see for the NPO status of the patient. Other than this, you need to determine the medications taken in the morning prior to the surgery, and you need to assess the skin color, temperature, the integrity, presence of any tattoos or bruises, and verification of placement of any metal implants like pacemakers that you need to assess. And one more thing which we need to see is the family support. So these are the things a nurse will be checking prior to the patient's surgery. Which of the following is an example of a local anesthetic? So is it diazepam, lidocaine, Pavlov and morphine? So here when we are talking about local anesthetics, you need to know that lidocaine and bupivacaine are the two medications that are considered as local anesthetics. So in this lidocaine, that has a rapid onset and a short to intermediate duration. That is, it has a duration of 60 to 120 minutes of action, and the maximum dose of lidocaine is 4.5 mg per kg, and it is the main local anesthetic we will be giving. And another one, bupivacaine, that has a slow onset and a long duration of nearly 4 to 8 hours of action. The maximum dose which we can give is 2 mg per kg, and it provides excellent post-operative analgesia. And one more point I would like to add is both this lidocaine and bupivacaine, these medications are mostly mixed with epinephrine for its vasoconstrictive effect to help the control bleeding at the procedure site, and also it prolongs the action of the medication. Which of the following is an airway used to support airway management in post-operative or during the intraoperative period? Is this a MAC, that is Mactosh laryngoscope blades, LMA laryngeal mask airway, endotracheal tube, or is it penicillin PCP? So here you need to know that during the surgery It is either a laryngeal mask airway or endotracheal tubes, or you can say a simple face mask that will be used to support the airway. And in this time I would like to add what are the different airway complications that will develop for a patient. It can be a laryngospasm, it can be a bronchial intubation, and it can be a tracheal and esophageal perforation or aspiration. So here the airway management includes laryngeal mask airway and ET tube. The nurse caring for a patient in the supine position on the OR table incorporates which nursing diagnosis into the plan of care? Risk for fluid volume deficit, risk for knowledge deficit, risk for aspiration, risk for potential alteration in skin integrity. So here the answer is the risk for potential alteration in skin integrity. So the greatest concern for the patient in supine position are circulation related and vulnerable pressure points like occiput, spine, scapula, olecranon, sacrum and calcaneus. So the problem is with the skin integrity. The nurse understands which actions are essential when providing support to the intra-operative patient and family during the operating room experience. Select all that apply. Introduce the patient and family to the surgical team members. Give family members updates every 2 hours as possible during the procedure. Explain what to expect from the operative experience. Alert the family to meal times. Explain that once the procedure is complete, the surgeon will discuss surgery outcomes. So as an intra-operative nurse, you need to introduce the patient and family to the surgical team members. And second, of course, you need to give family members updates every 2 hours as possible during the procedure because they are quite tensed. And explain what to expect from the operative experience. During the post-operative period also what will be happening, they need to be explained. The other two are not required. This is a scenario. Operating room patient is a 71-year-old widow who has a history of chronic bronchitis and eczema and no known drug or food allergies. She was brought to the emergency department by ambulance after complaining of severe abdominal pain for 2 days. She states that she has had bouts of diarrhea and vomiting for the last 2 hours with increasing right lower quadrant pain. She verbalizes to the nurse in the ED, "I am so weak I can hardly speak." Laboratory and diagnostic studies reveals WBC leukocytosis that is 12,500 per millimeter cube, neutrophil count 80%, and abdominal radiograph revealing hardened fecal matter in the appendix. Findings from her physical examination include moderate abdominal distension and rebound pain on abdominal palpation. The surgeon schedules for an emergency exploratory laparotomy with possible appendectomy. She is demonstrating non-verbal expressions of pain and anxiety. Her pre-operative check is completed quickly and she is provided with IV pain medication and a benzodiazepine for her anxiety. After proper positioning and safety checks are completed, the timeout is performed and surgery is started. She has her appendix removed without complication. Now, if patient indicates there is a family history of problems with anesthesia, it is important to discuss this with the anesthesia provider in order to avoid the use of which MH triggering agent. MH is malignant hyperthermia. Here you need to know about malignant hyperthermia. Malignant hyperthermia is a hypermetabolic state that can be caused by exposure to some triggering agents like volatile gas anesthetic except nitrous oxide. Volatile gas anesthetics, like if you are giving isoflurane, sevoflurane, desflurane. So if we are giving that, it will result in this hypermetabolic state, or another medication which is known as succinylcholine. If these drugs are given to the patient, some triggering effect will happen and that result in hypermetabolic state. So what happens is that the most specific sign of this is malignant hyperthermia is skeletal muscle rigidity. The first sign noted by the anesthesia or the nursing staff is an unexplained tachycardia for the patient, and also for the anesthesia provider, hypercarbia they will be able to note. That is a most sensitive indicator of potential malignant hyperthermia. And myoglobinuria is another early sign. In myoglobinuria, the patient's urine turns from dark amber to brown in color, and the word itself is malignant hyperthermia. But this hyperthermia, the classic sign of this MH is usually a late sign. These are certain things you need to understand. What happens is that when we are giving the triggering agents, it causes sustained muscular contractions. These contractions is a sign of hypermetabolism. So acidosis, tachycardia, hypercarbia, glycolysis, hypoxemia, hyperthermia, everything happens. So here the question is asking which agent when we provide that will result in this malignant hyperthermia, MH. Is it nitrous oxide? No. Other volatile gases other than nitrous oxide result in MH. It's not morphine, but the third one, succinylcholine, and not ketamine. The nurse understands surgical attire is worn for what purpose. Select all that apply. Prevent transmission of microorganisms between the patient and the team. Promote cleanliness in the OR suite. Prevent the spill of blood and body fluids to the surgical team's apparel. Promote confidentiality of patient and staff identity. Facilitate the surgical team working together collaboratively. So here, of course, to prevent the transmission of microorganism between the patient and the team, we will be wearing a surgical attire. Second one, to prevent the spill of blood and body fluids to the surgical team's apparel. Next, in the start of the surgical procedure, all members of the surgical team participate in a timeout. Which of the following are components of the timeout? Select all that apply. Correct procedure, correct site, correct equipment, laterality, and correct operating room. So here you need to know about timeout. Timeout is also known as surgical pause. So it is done prior to the start of the procedure to verify the correct patient, correct procedure, correct surgeon, correct position, correct equipment, and correct imaging studies if we are doing radiography. So you can see that the conduction of a timeout before beginning a surgical procedure or invasive procedure, that is essential in preventing all these wrong things like wrong site, wrong procedure, or a wrong patient. Joint Commission, they suggest that verification, site marking, and timeout procedure should be as consistent as possible throughout all organizations, including the operating room and other locations where invasive procedures are done. So here, correct procedure, correct site, correct laterality. While the patient is in the operating room, what considerations will be taken to ensure her safety and positive outcomes? Select all that apply. Is it a timeout, maintenance of sterile techniques, continuous patient monitoring, Instrument count or sponge count, breaks for personnel. When the patient is in the operating room, for the safety and positive outcome, you have to give a surgical dose. You have to check for whether everything is correct. You have to maintain the sterile field. You have to continuously monitor the patient. You have to check the count of instruments and sponges. The break for the personnel, the break for the team, that is required for the staff, that is not for the patient. Potential adverse effects of the supine position for surgery include which of the following? Select all that apply. Skin breakdown in the heels and elbows, venous pooling in the legs, ulnar nerve injury, retinal detachment, cerebral edema. So each surgical position carries with it some degree of risk that is magnified with the anesthetized patient. When the patient is supine, complications include but are not limited to skin breakdown in the heels and elbows due to prolonged pressure, venous pooling and risk for deep vein thrombosis, ulnar nerve injury due to the pressure on vessels and nerves. And if we are seeing cerebral edema and retinal detachment, they are not associated with positioning. So the answers are skin breakdown in the heels and elbows, venous pooling in the legs, ulnar nerve injury. Hope you understood this video. Thank you so much.